right? So now I've started the record for this. Let's quickly. So please write down the name of the unit, matrices, retainers, and wedges. As I just write the caption as it's all in your contacts. The one unit that I taught you in my last class, it is definitely in your contacts. Before I begin, can any one of you define contacts and contours for me? Just the definition. I just need the definition as quick as possible. Anyone for that matter. In your own language, just a one-liner or two words would do for contact and control. Yeah,
Ma'am, contact area is the point at which adjacent tooth of a jaw are in contact with each other.
okay. Adjacent teeth of the jaw or adjacent teeth are in contact. And can you define contour for me, please?
Mm,
Yeah. Go ahead quickly.
Ma'am,
Contours.
these are the convex maximum convexities on uh, the facial and the lingual surfaces.
Absolutely. Thank you so much for listening to my last lecture. Let's quickly watch this video. This video, you might not be able to grasp.
Yes, this is exactly what you're going to be doing when you come to final year. Let's quickly watch this. Tell me if it's audible.
In this procedure, I will demonstrate placing a Toffelmeyer retainer and matrix band on a molar tooth which has a class 2 cavity preparation. A wedge will be used to recreate the embrasure space between the missing tooth wall and the adjacent tooth. Here are the parts of the Toffelmeyer retainer. This is the outer knob. It is used to tighten the vise which holds the matrix band. This is the inner knob. It moves the vise and makes the diameter of the matrix band smaller or larger. This is the vise. The ends of the band fit into the slots of the vise. These are the guide slots to move the looped band to the right or left, depending on the tooth to be restored. Here are two retainers set up with the band exiting through the right and left guide slots. Holding the retainer, place it on the facial side of the tooth to be restored. The guide slots always face towards the gingiva. Push the band gently over the crown until seated. Tighten the inner knob to tighten the matrix band firmly on the tooth. Check that the band is stable. Using college pliers, choose a wedge and hold it with the base of the triangle in position towards the gingival margin. The wedge will be inserted on the lingual aspect. The wedge is only needed on the side where the tooth wall is missing. Now the tooth is ready to be restored. To remove the band, first remove the wedge with the college pliers. Unscrew the outer knob to release the band ends. Remove the retainer, keeping the bands in place around the tooth. This helps to prevent the filling material from crumbling interproximally. Gently remove the band with the college pliers, one end at a time. Floss the interproximal area to remove excess filling material.
Okay, let me just connect to my AirPods quickly.
Believe me or not, the video I just showed you might be not very important at this point in your for second year. But as you move to final year, I'm telling you, you would want to come back to this video and watch it like 10 times before you go sit for your practical exam. It is that tricky when you sit in your final year practical exam, you don't know anything, you're asking for help, how to remove the band, how to place the band, where exactly to place the wedge, all of that. So that is why we introduce this unit very early in your undergrad studies so that at least nothing you can relate to some part as you're growing up in your dentistry, right? So the good part is the video is obviously being uploaded, so you can check it out anytime you want. The good part also is you just have to listen to my class today and just have to write maybe the objectives of certain techniques, what is the definition, what is the meaning of certain technique. That is it. You just do not have to make a big, long note of this question as of now. Let's move on. The contents will be introduction, formulation of contacts and contours. Briefly, I covered in my last unit also, which included tooth movement, principal methods of tooth movement discussed in the last class already, rapid or immediate tooth movement, then we have flow or delayed tooth movement, matricing, objectives of matricing. Now, exactly, this is what I'm talking about. You can just quickly write down the definition of matricing. What are the objectives? Because these are the things we will surely ask you as a second year student in your Viva exam. So don't miss on that. Types of matrices. I gave you a long, very elaborative names of the methods in my last lecture. You will not find it anywhere in apart from this book known as Marzuk, right? Introduction, I've already told you, so I'm going to quickly cover contact areas. I discussed about the general shapes, which were tapering, square, ovoid. These were the shapes. I got you my own drawn diagrams in the last lecture. This is exactly what you're going to find in this book known as Marzuk. Tapering, square, and ovoid. So this and the last unit are absolutely interrelated. Then I'm not going to discuss this. I already covered what are the benefits of creating and respecting the shape of a particular tooth. Then I also discussed about embrasures, right? The ridges. This was forces acting on marginal ridges. I told you for you what is important is to know that there are two kinds of factors. One is horizontal factor, the other is vertical factor. The only thing that you need to know as of now is that making sure the height of marginal ridges on the two adjacent teeth are equal in size. Okay, they're coming at the equal level. Then this is what were the hazards of not creating the perfect, contact, broad contact, narrow contact. Contact placed too buccally, what all can happen if you flatten the occlusal marginal ridge like you can see in the picture on the right, creating this. This is just a very elaborative description of what will be, taught to you as you move to third year and final year. And I promise you that this unit will be covered in third year as well as in final year. So I'm not giving you a headache by being so elaborative at this point in time. So absence of marginal ridge, as you can see, there is no factor in the other next adjacent tooth, as you can see in a canine. So you should know that an exaggerated occlusal embrasure. This is what happens when there is a bony defect due to incompatibility. You're not able to restore it properly. There is bone loss present. No adjacent triangular fossa has been carved. No occlusal embrasure. One planed marginal ridge. In the last class, I told you that it should be two planar, thin marginal ridge. So this is exactly what we discussed, was the last note in my lecture, the last time, procedures for formulation of proper contacts and contours. People who did not attend the last class, please check this video out so that you can, relate better to the class, today's class, because today's class is a little tricky. It has all the topics for third year and final year. So you just have to pick your topic and just leave the rest. Don't be, anxious about the other topics. Next is tooth movement. As I told you, it's an act of either separating the involved teeth from each other, bringing them closer to each other, and or changing their spatial position in one or more dimensions. Now, I would want you to take down this definition. I am assuming that you've already taken in my last lecture. These are the things we will ask you as a second year student in your Viva exams, and we would expect that you know these at least. Okay. Objectives, if I did not, I'm telling you today, I think I did, but start writing quickly, just in your own words, start writing. What are the objectives of tooth movements? Is the objectives are to bring drifted or tilted or rotated teeth to their indicated physiologic positions. To close space between teeth not amenable to closure by contemplated restoration. To move teeth to another location so that when restored, they will be in a position most physiologically accepted by the periodontium. Please write down, we expect you to know at least this much key objective kya hai, right? Others, to move teeth occlusally or apically in order to make them restorable. To move teeth from a non-functional or traumatically functional location to a physiologically functional one. To move teeth to a position so that when restored, they will be in the most aesthetically pleasing situation. Right? And we have six, seven, eight functions or objectives of tooth movement, and I would want you to write the exact eight objectives whenever asked in your undergrad level. These eight objectives, don't just write any bullshit. You have to write exactly like these objectives. Don't just make up the objectives. You already have eight objectives. Let's move on to the last two. To move teeth in a direction and location to increase the dimensions of available tooth structure for the resistance and retention form of the contemplated restoration. To create a space sufficient for the thickness of matrix band interproximally. This is necessary to create a positive tight contact. Now, you as an undergrad student, I am sure when half of you will step in your final year and when they ask you what is the objective of tooth movement, the only and only thing that pops up your head is the last one. Everybody is going to be like, oh, why do I want tooth movement? The only thing that most of you will say is so that my matrix band it can be placed in the interproximal area nicely. That's all you know, and that is so wrong at this point. That is why I'm telling you we've got eight objectives. The only objective that we use in in cons is the last one, but that does not mean you have no other objectives in tooth movement, right? Let's go quickly. These were the eight objectives: 1, 2, 3, 4, 5, 6, 7, and 8. Okay. Let's move to the principal methods of tooth movement. In my last lecture, I have already asked you to jot these down. Quickly moving: rapid or immediate tooth movement, slow or delayed tooth movement. Under rapid or immediate, we've got wedge method, under which we've got Elliott separator, wood or plastic wedges. The next method we have under rapid or immediate is traction method, right? Under slow or delayed tooth movement, we've got three, which are separating wires, oversized temporaries, orthodontic appliances. For today's class, I'm going to be a little elaborative and descriptive about these methods, right? Let's move on to the rapid or immediate tooth movement. It's a mechanical type of tooth separation. Now we expect as a second year student, we expect you to know the methods and at least be little descriptive about these methods, okay? So don't just take this unit very lightly. We want you to at least know the headings of this unit, not be like, oh, I don't know what is matrices, retainers, and wedges, okay? So mechanical type of tooth separation, which is rapid or immediate tooth movement, it should not exceed the thickness of the involved tooth periodontal ligament, as more separation can tear these ligaments at one side and crush them at the other side. As you grow in dentistry, you know that you have to respect the periodontal ligaments. It has got numerous fibers which you have to respect, and that is why even an orthodontist will respect the periodontal ligament. If he or she applies more force, your tooth will eventually resorb, and it will have bone loss and it will die. So you should respect the periodontal ligament, and your thickness should not exceed the thickness of the involved tooth periodontal ligament. As in, I'm trying to say it should not exceed 0.2 to 0.5 mm. Just know that much. Next we have is, I'm sorry, yeah, quickly. Okay, rapid or immediate tooth movement, just exactly what I showed you in the video. This is what you're going to do when you come to your final year, placing your wedge, placing your matrix band, and getting the contacts right after doing a restoration. The tooth is in its normal physiologic contact, right, as you can see. Next we have is wedge method. Separation is accomplished by the insertion of a pointed wedge-shaped device between the teeth. In order to create separation at that point, or closure on the opposite proximal side of the involved teeth. The more the wedge moves spatially or lingually, the greater will be the separation. I repeat, separation is accomplished by insertion of a pointed wedge-shaped device between the teeth in order to create separation at that point or closure on the opposite proximal side of the involved tooth. It is just not separation that you gain sometimes. Sometimes it is also closure of the opposite proximal side of involved teeth. Next, we have in case of rapid is Elliott separator. As you can see, the diagram on the right is an old method. Just you can quickly draw the diagram because in exam they ask you a long note. In final year, they definitely ask you a long note. So you can relate to your second year studies also. Elliott separator is a short duration separation that does not necessitate stabilization, is useful in examining proximal surfaces or in final polishing of restored contacts. Now, why I'm asking you to just quickly draw the diagram or is just know the name. If sometimes not even in my class, there are things that you'd like to know more about. Just write this on YouTube and check a video of alien separator. So you'll be clear once and for all, right? There is wood or plastic wedges. These are triangular shaped wedges usually made of medicated wood or synthetic resin. The base of the triangle will be in contact with the interdental papilla to the gingival margin of proximal cavity. Now quickly write this. We ask you in the viva कि base किस side पे जाके contact करता है and apex किस side पे जाता है. There are two sides of a wedge, right? So the base of the triangle of your wedge will be in contact with the interdental papilla to the gingival margin of proximal cavity. The two sides of triangle should coincide with corresponding two sides, which is mesial and distal, of the gingival embrasure. The apex of the triangle should coincide with the gingival start of contact area. If you're not able to understand, just look here. It looks like a triangle, doesn't it? The wedge, the topmost diagram, it looks like a triangle. As they told you, the sides of this wedge, the second point here, the two sides of the triangle should coincide with the corresponding two sides, which is mesial and distal, right? The apex of the triangle should coincide with the gingival start of the contact area. Now look at this wedge. Square end off for a secure grip, the rounded tip to prevent gingival trauma. Just quickly draw this diagram. The concave sides perfectly adapt along the entire cervical margin in the interdental space, which is your medial and distal side. Now you can look at the picture down there. It shows exactly the correct placement of a wedge before, after, and after, before, during, and after the placement of a restoration, right? Functions of a wedge. Now, this is most important. A lot of people will ask you throughout your dental career what are the functions. So you just end up saying that one thing that you do. You're like, oh, when I'm doing a class 2 restoration, I place a wedge just to separate the two teeth. That's so wrong. That's right, but that is very limited knowledge for you. So you should know all these functions that I'm quoting here. The first one is show the close adaptability of matrix band to the tooth, gingival to gingival margin of the preparation. Start writing to assure close adaptability. Next is to occupy the space designated to be in the gingival embrasure, preventing the restorative material from impinging on it, right? The third is define the gingival extent of contact area as well as the facial and lingual embrasures. The first is to assure close adaptability of the matrix band. The second is to occupy the space which is designated for the gingival embrasure. Third is to define the gingival extent of the contact area that you will be creating. Next is create some separation to compensate for the thickness of matrix band and minor drifting of the teeth. It does create slight separation to compensate for the thickness of band and the minor drifting of teeth. Next, establish atraumatic retraction of rubber dam and gingiva from the gingival margin of the cavity preparation and thereby producing a temporary hemostasis and minimizing moisture. Now, when you step into your next year, you know that we will teach you about isolation methods or exactly how You can accomplish isolation or a state of complete hemostasis while you're doing a restoration. No contamination, no saliva, no water, nothing. So one such huge device, a huge, what do I say, advantage for us in cons is something known as rubber dam. It's a device which will give you full-fledged isolation. And in such cases also you can use a wedge to get rid of, all the contamination. We have to assure the immobilization of matrix band against movement both spatially and lingually, as well as cervico-occlusally during insertion of restorative material, and that is one another reason to go for a wedge. We have to protect the interproximal gingiva from unexpected trauma. So now at this point, you might feel that there's a lot of mugging up that has to be done for this unit. Believe me, it is the same kind of mugging that you thought when you were reading about fundamentals of cavity preparation. And sorry for your bad, since you're not able to step in the preclinicals as of now. So it's very hard to relate the fundamentals. But believe me, when you do start with your preclinicals, when you're doing your plaster models and then moving on to typhobasis, in no time you're gonna realize that the fundamentals of cavity prep is not a theory chapter. It is absolutely practical, and this is why I repeat this. There's no mugging that you have to do. Once you get a hands-on with the wedges, once you get a hands-on with your class 2 preparations, all of this will make a lot of sense, right? For now, all I want you to just write the objectives and functions. Quickly moving from wooden wedges, the main advantage of wood wedges are that they are easily cut and trimmed and they absorb water intraorally. The reason we put wooden wedges, medically wooden wedges, is so that they can absorb water intraorally or any contamination or crevicular fluid. This causes them to swell, improving their interproximal retention, right? Raisin wedges are also available. The main advantage of raisin wedges is that they can be plastically molded and bent to correspond with the configuration of the interdental call. For this, the wooden wedges, if you try to mold them, they're gonna break because these are made of wood. But not so much for raisin wedges. You can mold these as in how the shape of the tooth is, as in how the shape of the interdental call is. For instantaneous separation of teeth during operative procedures in anterior teeth, planing the axial walls, this is planing and not planning, accentuating the line angles or polishing, can't do with that, okay. Accentuating the line angles or polishing in class 3 restoration, wedging the nail of thumb or the first finger between the teeth will make rapid separation, which is usually sufficient for these purposes. So for you, just remember there are two categories. One is wooden wedge, which will absorb water intraorally. The other is raisin wedges, which you can mold, right? You can look at the image and remember in your head. Next is traction method, as we just discussed. What was traction method? Let me just clarify again. Traction was the next method for your rapid or immediate tooth movement. We'll quickly go through traction method. In traction, it is always done with mechanical devices which engage the proximal surfaces of teeth to be separated by means of the holding arms. These are mechanically moved apart, creating separation between clamped teeth. These are the methods with which you can perform a traction. Indicated one is non-interfering true separator. As you can see, this image is really old. Just write the name and try to YouTube it for more clarity. Indicated when continuous stabilized separation is required. Now these are old methods. As you can see, the device is very bulky and large. So these were the most ancient methods that were used before easy methods, which I will be discussing. I will quickly cover the evolution that we have seen in matrices, retainers, and wedges. Separation can be increased or decreased after stabilization and the device is non-interfering. Let me just have a sip of water. Non-interfering through separator. Ferrier. Now these are the methods covered in traction, right? Okay, let me just, yeah. If we can relate to this slide everywhere, then that's awesome. Though I'm still covering the rapid or immediate tooth movement, then we have slow or delayed. So traction, I just covered non-interfering, true separator. Next we have is Ferrier double bow separator. Ferrier double bow separator. Separation is stabilized throughout the operation. Separation is shared by the contacting teeth, not at the expense of one tooth as with the previous type of instrument. These are Ferrier double bow separator images. As you can see the image on the right, this is exactly how we used to do back in the day. I know it looks very bulky and very, I don't know, a lot of job in there. So now all you can see, we are giving you everything in, we're serving you everything which is nice and easy, but it's your duty to know where exactly this is coming from. Ferrier double bow separator. The device, if the in exam you have to write about it, please draw this diagram. Next is slow or delayed tooth movement. A person who's got an ortho treatment can relate to the elastics. The image that I'm sharing on the right, they know exactly what an ortho guy will do to you. When teeth are drifted and or tilted considerably, rapid movement of teeth to the proper position will endanger the PDL. That is why we will go something for a slow or delayed method, and that is why your orthodontist will think of undergoing taking you through the slow or delayed tooth movement. Therefore, slow tooth movement over a period of weeks will allow the proper repositioning of teeth in a physiologic manner. Separating wires, the first method, thin pieces of wire are introduced gingivally to the contact, then wrapped around the contact area. The two ends are twisted together to create separation not to exceed 0.5 mm. The twisted ends are then bent into the buccal or lingual embrasure to prevent impingement upon soft tissue or interference with food flow. The wires then tighten periodically to increase the separation. This is exactly what your orthodontist will do to you. Next is oversized temporary with nothing. It's just the temporary restoration we give in an inter-appointment visit. I'm going to quickly show you an oversized. Okay, when you move to the third year, if you're not able to complete the restoration in one go, your staff or your faculty will tell you to give a temporary restoration so that you can remove the restoration very easily the next day before you provide a final restoration. This is exactly what a temporary restoration looks like. Coming back to oversized temporary, so what is the important term? It is oversized. We are giving an oversized temporary restoration. It is from resin temporaries that are oversized mesiodistally may achieve slow separation because these are oversized. Resin is added to the contact areas periodically to increase the amount of separation, which will not exceed 0.5 mm per visit because you have to respect the PDL at all times. Orthodontic appliances, these are the appliances a person or friend of yours who has undergone an ortho treatment can relate better, and it is painful. Painful as in you're not able to eat whatever you like. So it's maybe you can lose a lot of kilos when you have braces. Orthodontic appliances for tooth movement of any magnitude, fixed orthodontic appliances are the most effective and predictable method available. Comparable end results may be achieved by removable orthodontic appliances, but they require longer treatment. In today's time, we've got a lot of advancement in these kind of orthodontic appliances also, Invisalign and a lot other kind of methods are available in ortho that you will it will interest you once you move to final year and your interest of field is ortho. After this is all about ortho, so I'm not gonna just remember orthodontic appliances, oversized temporaries, and separating wires. Matricing. I described the definition of matricing in my last class, quickly walking you through that. It's a procedure where a temporary wall is created opposite to axial walls surrounding areas of the tooth structure that were lost during preparation. We would want that each one of you should know what is matricing, how do you do, how do you accomplish matricing? You should know the definition, the objectives, so that is why this is very important as in cons is related. Procedures whereby a temporary wall is created opposite to axial walls surrounding areas of tooth structure that were lost during preparation. It is used with restorative materials that are introduced in a plastic state. The matrix wall should possess the exact three-dimensional contour of the future restoration. Right? Let me just quickly show that. So you can relate better. I know I'm just taking a lot of time, which I don't have. Maybe I don't have it. It was in the video only. Okay. Maybe I have it in my subsequent slide. The matrix wash should possess the exact three-dimensional contour which you are planning to, get after your future restoration is done. The matrix should be capable of imparting this configuration to the inserted restorative material, which again is in the plastic form during its plastically deformed state, right? Not only should it be immobile, it should not move. Your band should not be very it should not be absolutely mobile, because if it moves, your restoration will move here and there. You won't get the perfect contour, the physiology contour that you're aiming at during the setting of restorative material. But also, it should not react with or adhere to the restorative material. It's easy and clear. Hope you're writing it right. What are the components of the matrix? The first one is a band, second is a retainer. Now, this is exactly your bread and butter if you're doing a class 2, class 1, or whatever restorations in cons. Band is a piece of metal or polymeric material used to support and give form to the restorative material during its introduction and hardening. This is my favorite question, Viva question, as far as matrices, retainers, and wedges are concerned. So please remember this question. Retainer is a device by which the band can be retained in its designated position and shape. The retainer could be a mechanical device, a wire, a dental floss, and or an impression compound. Right? This is what these are the types of retainers you will come across as you move to your final year. You can see one is a straight retainer, there is a little curved kind of a retainer also, then there is an ivory retainer. As you can see, this the one looks like this, the third one from here, the third image, which is this, the third one. Okay, we will show you in your spotter exams and ask you to actually identify which one is what. Then these are the bands with varying occlusal gingival measurements. We have straight bands also. When you step to final year, we will ask you to use straight bands. Let's quickly go to this video and show.
What TOEFL Myers are there?
allthingsdentistry.com. We're talking about Toffenmeyer Universal Matrix Systems for amalgam placement. And the reason why I'm talking about this is that a number of viewers actually asked me just for some tips and hints on complex amalgam placement. Now, amalgam is controversial and slowly it's going away. But some of the key factors in amalgam placement, especially the matrices, can be used for composites. So a few neat things about the Toffenmeyer matrix. I mean, there are definitely many, probably thousands of different brands out there. This is the Omni Matrix. There is the Auto Matrix. I have another one here. There's a Palodent, but that's difficult for complex. This is the Super Mat. Another, essentially, a stainless steel matrices with some sort of a holder and a tightening system. So just about the Toffenmeyer matrix, and really I just learned about it myself actually this past week in just sort of reviewing and asking for some other hints. Now there are wide different variations on the same theme. You've got typically two different types. Take that little guy out for now. And you can see that, I don't know if you can see the difference here. This one, according to the textbooks, they call it a contra angle. And you can see it's a little more of an angle relative to the...
Just like you've got contra angle hand pieces, right? The ones that you're going to be using right now is micromotor hand pieces. And we have contra angled and straight, just the same way we've got contra angled Toffenmeyer retainers as well.
To the threads on the screw here. Compared to this one, which is almost 90 degrees. Now, the reason why this is like this is because it can be used lingually. Now, often, I remember learning that in dental school thinking, I don't understand why it has, I just know that this is for the lingual version. No one told me why. Well, here's why, as I just figured out from cutting the video. when you place it on the lingual portion of even the palate or the mandible, this has to be able to be angled in an effort to, well, jump the teeth, if you may. So it can be used on the excuse me, on the buccal, but I've tried, and it's fairly difficult to use the straight one.
So when you go buy or go for the shopping of a Doppelmayr, you should know in college we'll ask you to get a straight one only, because we will be placing it buccally, not lingually. But if you're confused at the shop, you should be aware that the contra angle is so that you can place it lingually as well.
On the lingual portion of your preparation. Say, for example, you're trying to replace all these your buccal cusps, and your lingual cusps are still intact. A little more difficult to place it on the buccal. So, hence the reason for what they call the contra angle. Now, another thing, I don't know if you're aware, but this became aware. Well, you can make noise, man. Come on in. I appreciate it. Is that this, because there are a number of different bands available. We've got classically the number 1 band and the number 2 band, or the MOD band. Then there's these pedo bands. So often, well, not often, say occasionally, I'd be handed Tofflemire Matrix. The band would be in it already, and then I go to tighten it, and it never seemed to tighten properly. I finally figured out why. There are 2 different types. You've got pedo version, and you've got the regular version. And the pedo version just seems to be just short enough to become frustrating when trying to tighten your matrix. So let's see. Okay, so here we have the different matrices loaded up. Actually, these are just the number 2 matrices in the pedo Tofflemire and in the regular Tofflemire. And let's take a look at the pedo. So often, or I should say occasionally, I'd receive one of these, and one of these Tofflemires, a pedo Tofflemire. You can see that there's just a little bit of band that's not covered by the holder. Now, that would seem insignificant, but I'll tell you, when you're trying to crank this down, tighten it up around a tooth intraorally, and it starts to slip, and it seems to always want to slip that way, it becomes extremely frustrating as compared to the appropriate Tofflemire that is flush. And again, this cannot be placed. It's really difficult to place this lingually. But if you do have the contra angle.
So what exactly we learned from this video is that this is exactly what you're going to be doing in final year. Forget about the part where I'm teaching you about contra angle and straight, but this is exactly what you're going to be doing for a class 2 preparation. And when we give you this device, 90% of you will be absolutely shit confused how to use it. So I'm just showing you that you have to first sit for an hour with this device and just be friends with the device, and then I don't think so you're going to face any problem, right? If you need better adaptability of your band to create the wall, then you can also burnish your matrix band, as you can see. I don't have time to show this video.
To sink down towards the diagonal.
It's a great video. So I would recommend you to come back and watch this video. If this lecture is uploaded, please watch this video. Okay, let's quickly write down the objectives of matrix. It has to displace the gingiva and the rubber dam. It's the device that we use for isolation away from the cavity margins during introduction of the restorative material. It has to assure dryness and non-contamination of the details. Yes, we do not want any blood or contaminant coming inside your matrix band. It should provide shape for the restoration during the setting of the restorative material. Most of you will just tell if we ask you in the Viva, you're just going to be like, it has to provide the shape of the future restoration. Please know there are other objectives as well. It has to maintain its shape during hardening of the material. It has to confine the restorative material within the cavity preparation and predetermined surface configuration. Matrices for class 1 cavity preparation. In the last class, I gave you a lot of names of restorative, or a lot of names of matrices. I hope you've written now. So we've got a lot, just the same slide I've got you. Single-banded Tofflemire for class 2 designs, 1, 2, 3, 6, 7, 8 cavity preparations. Ivory matrix number 1, ivory matrix number 8, Blacks, now we will give you in your spotter exam, we will ask you to differentiate between ivory matrix number 1 and matrix number 8. Now let's go back to, please remember these two things. This is an important Viva question, and the reason I'm going back to this image is to show you this exactly these two. Okay, how do I, let me just crop this and show you better maybe. This is an easy trick that I used to remember which one is what. There are two kinds, ivory matrix 1 and ivory matrix number 1. Oh, 8. So the one that actually, the one that, sorry, this image, the one that actually looks like figure 8 is the one which is 1, which is ivory matrix number 1. And the one which is straight is actually ivory matrix number 8. So they are opposite. The one that looks like 8 is ivory matrix number 1, and the one that looks straight is actually ivory matrix number 8. I hope I'm clear. Never forget this. This we will show you in your exam and ask you to differentiate between the two. Blacks matrices, soldered band or seamless copper band, anatomical matrix, roll and band matrix, S-shaped matrix, T-shaped matrix. I am telling you, you are supposed to write the names when a question is thrown at you in your final year. Don't just write, okay, I just know about ivory matrix number 1 and 8 क्योंकि हम तो ये use करते हैं और कुछ आता नहीं है. You should know the names, okay? But for a second year student, just knowing the names and looking at the pictures that I'm showing you today. TOEFL My Retainer, I've showed you enough of the videos, and few of them you can go back and check on my recorded class. And this is bands for TOEFL My Matrix. I showed you one is speedo, one is a straight band, one is, these are molar bands which are thicker in the center so that you can create a larger height of the wall. Wedge placement comparable to the dimension of the future gingival embrasure is chosen and tried. The wedge should be trimmed using sharp knives. Not very important. Let's go. The correct and incorrect wedge placement, as you can see in the image 1. Why is it a correct placement? Because it is not impinging on gingiva 1. 2. The future wall that you're creating from the matrix band, it is also not impinging, and it is not impinging on your matrix band, and if it is not impinging, your future restoration comes out with a proper contact. But in the image B, you can see your matrix, your wedge has absolutely ruined your placement of the matrix band, and this is how exactly will be replicated in your restoration. I hope I'm clear. So try to look at your restoration like this from this angle. When to place more than one wedge? When we have gingival margins which are located very apically, proximal preparations which are adjacent to a very exaggerated interdental column. Sorry, my mother's in the mandir and she's doing puja, so you will be hearing a lot about this. Gingival margin is located in a proximal surface concavity or defect. More separation is needed than can be supplied with one wedge. Extraordinarily large gingival embrasure. I think I did cover part of it in my last lecture, just showing when exactly how you can place the two wedges. This figure, beautiful images coming from your Sturdivant, which is like the newest edition. You will easily find these figures in bits and pieces on 2-3 pages. I've got you in one slide. If you want to study from this, it's gonna be there on my YouTube. This is the ivory matrix number 1. This is exactly what I was telling you. The one that looks like figure 8 is actually ivory matrix number 1. We will surely keep this in your spotter, so you should know. Band encircles the posterior proximal surface, so it is indicated in unilateral class 2 cavities. You can very easily do your class 2 cavities with these also. Band is attached to the retainer via a wedge-shaped projection which engages with the tooth at the embrasure. So when you go buy your stuff from Shahwala or any goddamn person, they will fool you by giving you this. You should know exactly what we are asking you to get, so don't just get these. Ivory matrix number 1. The one that looks straight is actually ivory matrix number 8. The band encircles the entire crown of the tooth, so it is indicated for bilateral. Now you do understand bilateral and unilateral ka kya matlab hota hai. If it's one class 2 cavity, if it is suppose MO or DO and not the entire MOD cavity, then you can go for a ivory matrix number 1. But if in case it's a bilateral, as in you have MOD cavity both on mesial and occlusal, then it is important for you to place a band like this. And matrix band like Black's matrices, I told you, gave you a name, few names. These are Black's matrices for simple cases, recommended for majority of small and medium-sized cavities. As you can see, this was given by G.V. Black. This is the one with gingival extension. For you, in case you want to write the answer in finally, just draw these diagrams. They will fetch you the complete marks. I'm telling you, the information is so apt and good enough for a postgrad resident also. So don't be afraid. Just remember the diagrams and don't have to mug up anything. Next we have is Black's matrix with gingival extension. As you can see, it is extended a little down from the gingival area. Then we have the copper band or the soldered or seamless copper band. This is what you do. You place the band and then you try to adapt it using a impression compound or something, and then you place it. I know it looks very difficult, but these were the older methods. Anatomical matrix methods in which you place a band like this and then you adapt it with your impression compound and this becomes your entire cavity. Roll in band matrix, auto matrix. Now these are S-shaped matrix. These are old methods. Just remember the names and you can come back to the video and draw the diagrams. Remember the diagrams. T-shaped matrix bands, right? You have to lock it like this after placing, encircling the entire tooth. Then matrices for a cavity preparation for amalgam restoration on the distal of the cuspid, which is your canine. This is your distal of the cuspid S-shaped matrix band. Just remember the names, don't worry. We are not going to ask you to practically do these now. Nobody does these. We have easier methods. I'm just trying to tell you, or maybe tell you the evolution that has happened in matrices, retainers, and wedges. Now let's quickly see the evolution. So this was back in the day 1946, Stoffel-Meyer retainer-based systems. I showed you. This is exactly what we ask you to do in your final year. We're still living in that century. You have to do that. Then we have Automatrix, which is now if you go to a very posh and great clinic, you're going to see they have Paladin system. What is this Paladin system? I'm going to show you quickly. Circumferential matrix band, traditional system, circumferential bands. This is what you're going to get to our department when you step in. These are the bands. The first two images, the first topmost images, traditional system and the circumferential bands. This is exactly what you're going to get in the department. Now this is just the evolution that has happened. Omni matrix. This is a plastic kind of matrix and you adapt your band to it. Then this is Pro Matrix. A lot is available on your dental card, on your pink, blue, and a lot of international sites. So don't get confused. It is just the evolution that has happened over the time. Pro Matrix, again, a plastic kind of a slimmer body, fixed head, band deflectors. The straight band you can adapt and roll in is very easy compared to your Toffel-Meyer. Automatrix circumferential band. Now this is the one a lot of people who cannot afford the Paladin system will also have Automatrix or Promatrix at their clinic. Automatrix also has a lot of small bands you can use and throw them. These are disposable bands as you can see. So this is all just the evolution. I know it's a lot of information to take as a second year student. Just remember, when you start practicing, you will be using the best of techniques only, but you should know where exactly this evolution happened. This is another video. Please come back to the channel and watch this video so you know what is automatrix and how do we adapt it to the tool. Next we have is sectional matrix systems. These are the ones which are used today. Sectional matrix it's not very expensive as compared to Palodent also. Palodent is also one of the sectional, but it is kind of most expensive one out there. You see there is a circled traditional this is a traditional sectional matrix. Now I'll show you Palodent so you can see what exactly how it has evolved. Let me show you. An early tined separating ring was how they started with sectional matrix. Now what we have is this is what Palodent plus or Palodent V3 is times up. So you can see, take a picture of this maybe. This is kind of expensive, but if you're working in your clinic, posh clinic, and you know all the basics of your conservative dentistry, then you deserve this kind of a device to operate on your patients, right? Palodent system. So see where we're coming from. We're coming from Toffel-Meyer retainer to this Paladin Plus, right? This is how you adapt to it. Very easily available on the internet. You can watch hundreds of videos on Paladin and you're going to absolutely fall in love with how easy this is, right? This is the examples of modern wedges which are available. Yes. See, now can you just imagine what all development and advancement that has happened over the period of time? Modern separating rings, just like Paladin, we have 10,000 available out there. Coated sectional matrix bands, longer, super curved in restoring larger preparation. As you can see, there is a kind of band which is there's a kind of tab which is there for gingival protection also in case it has super curved non-stick bands available. This is again a video on Paladin. Please go watch it.
The wedge you play if needed.
If you do not want to come to my YouTube channel, you can go to your YouTube and just search for Paladin and just I would want you to see this video. It's an absolute amazing video on Paladin
To
system.
go on your class 2 restorations and
These are
pin
the
tweezers.
wedges. So this is a complete system. It has its pliers, it has its wedges, it has everything. You just have to buy this expensive shit and then just be done. You don't have to buy your wedges separately or anything like that. You're sorted. Only thing you need to know is you should know the basics of what you're doing. Sterilization, this is like a PG level lecture that I created back in my day. So not very important. All you need to know is that it does get contaminated with blood and saliva. So you absolutely need to get rid of your bands, okay? You have to get rid of your bands, and the other device, you can clean it under ultrasonic cleaners, or these are ultrasonic cleaning solutions available, enzyme tablets, dual enzymatic detergents that you can use to clean the device, not the band. You should throw away the band. These are other cleaning solutions available out there. Manufacturing instructions, they say you can, when we talk about the stainless steel automatrix band, the manufacturer itself says that you can, because the device has a lot of tools, you can autoclave it at dry heat sterilization. So all these you will come across when you read the buy a product and possibly read the manufacturer's instructions. This is again the Paladin Plus. Yes, they have been tested successfully through 10,000 autoclavable cycles, so you can autoclave these. So I know I rushed a bit in the end, but why did I do that? In the end was the end part was actually none of your business at this point, but I still really wanted you to see what exactly we have in practice right now in 2021, right? That was my idea of you showing you the entire journey. Otherwise, I would have cut short this presentation to only 35 slides, right? But in your head, you would have been, okay, this is what the evolution has happened. We just have to use Toffelmire. It's a very, very, very tricky device. And I think there has been no advancement in Toffelmire. When I today actually give you a Toffelmire, I'm telling you, after 1 hour of, losing your head with that shit, you're going to come crying to me and be like, I have no idea how to use this, right? I'm telling you, half the people will do this, but it's not a very difficult device. I'm just telling you, when you first buy Toffle My Retainer and band, waste 2-3 bands. The device does not get wasted. It is there for you. If you buy a good branded one, it's there for you for like for a long, long time. So just spend 1 hour before you actually come to the preclinical, and maybe spend 1 day before you sit for your exam practical. Am I clear? Half of you don't spend time with your TOEFL mind. That is what happens. You just get very nervous and anxious, right? So it's time. It's 12:04. I need to let you guys go. If you have any questions, just quickly tell me. Half of you sleeping again. Let me take a screenshot and I'll send not you, but to the admin. Any questions, please throw me. And half of you also left the class. That's amazing. 37 students. That's nice. Okay, I'm sending the entire history to the admin. Any questions? 35 parts. That's a shame. That is a shame. Who's the CR of this class? No CRs as yet?
Yes, ma'am.
CR. So this is disappointing. That's very disappointing. Only 32 what? 30 students sitting in the class. That's highly disappointing. I mean, your third years and final years are 10 folds better than you guys. We have full audience sitting. They have interactive sessions. I think we had a lot of audience in the beginning of the class, and now since I don't know, I'll make sure that people who've left the class, I have the data, they will not get their attendance. Okay. On that note, I'm gonna end the class. Any questions from the decent students still sitting in my class? Any questions? No questions. Is everything clear to you guys?
Ma'am.
Sneha, roll number 54.
Yes, ma'am. Ma'am.
Do you have any question, roll number 54?
Yes, ma'am. Ma'am, what we have to study in this topic? Exactly.
Okay, that's a very legit but funny question. It's like Ramayan Khatam ho gayi. Now she's like, can you narrate the entire Ramayana once again for me? And it's absolute. Can you mute yourself, 54? Yeah, I don't know your name. It's not written there. Don't worry about the topic. As the topic says, matrices, retainers, and wedges. Okay. One thing is clear, that you don't have to worry about the data. Okay. You don't have to worry about the notes part, right? It's out there for you. It's gonna be there. And the good part is nobody is giving you a long note question as of second year is concerned. You only get a preclinical exam, right? You don't get a written exam, you right? So it comes down to the viva questions, doesn't it? Doesn't it? So first, when you walk in the department, we'll start with your preclinicals, right? We'll ask you to create class 1 cavities, class 2 cavities on plaster models, and then we'll introduce you typho bases, right? That's how it goes, right? The only thing we will be asking you is the fundamentals. And when you step to class 2 cavities, what exactly are we going to ask you? I showed you this video where you created a class 2 cavity and then you started placing your band, your wedge, whatever. Roll number 54, can I know your name? Because speaking the whole roll number 54 is
Ma'am, Teja.
Pooja.
Yes, ma'am.
Okay, you can rename yourself the next time you log into your classes. It's easier for us to interact. So, Pooja, the thing is, believe me, it's easy. The only thing that we are eligible to ask you as of now is the only thing that you're using in your preclinical, lab. The cavities, how do you prepare it? What all stuff that you're using for a restoration, right? It can be your wedges, it can be a band, it how to place a band, what are the functions, the objectives. That is it. It is narrowed down to that much. Okay. But when you move to final year, you can expect a full-fledged question on this unit. Am I clear? So don't worry about the
Yes, ma'am.
theoretical aspect of the unit. Just worry about the practical and how to identify what all armamentarium you will be using in your preclinical. Am I clear? Okay.
Yes,
Anyone
ma'am.
questions? Anyone? No, it's late. Do you have another class coming up? Okay, thanks for interacting. Still a very slow class. See, things are difficult for you as a second year. You might be very disappointed that you are not able to do the practical aspect of dentistry. We all get that. But believe me, if you don't make use of this golden time, and when you actually come to the department and start, we are going to ask you questions like that. We're going to be expecting that you're well read whatever is taught to you. So please, a good advice, use this time to whatever is being taught to you. Please understand, don't miss your classes like that. 30 students sitting in a second year class, that's a shame. That shows how much you're dedicated. And I'm not coming at you guys who are sitting in the class. Thank you so much for sitting in my class. I respect that. Okay, with that note, I'm gonna end the class. I told you that the class is being recorded. I'll try my best to post it by the end of this week. You can find the lecture right here. The first lecture before contacts and contours will be matrices, retainers, and wedges. Take as much as you want for a second year person. Make notes of it. Identify the armamentarium, and you're good to come to the department and sit for your exam. Am I clear? Okay, thank you for listening. Have a good day. Take care of your parents. Bye bye.
Thank you, ma'am.